The NHS Health Check Scheme is for adults in England aged between 40 and 74. The intention of the programme is to identify those most at risk of developing cardiovascular disease, stroke, dementia and type 2 diabetes. However, our local intelligence on the Wirral highlighted that the most people who aren't attending health checks are the BAME community, alcohol and drugs misuse, men, and also early disease deprivation. So this is what we wanted to target in this programme. We know that targeted interventions are more effective at connecting with the community and improving health outcomes. For this pilot, we approached 4 community centres where these people are going in, day out, which are Wirral Change, Wirral Multicultural Organisation, CGL and also Make It Happen Birkenhead. We wanted to make sure that we are going to people to do these health checks instead of making them come to us.
So it's important for us to provide all the community organisations with training that covered all aspects of the health check, from cholesterol testing through to measuring weight, blood pressure, so on and so forth. We also want to largely focus around the conversational element of the health check. We know this is a big part of improving people's understanding and also doing it in a sensitive way. So we used kind of health coaching type concepts that encompasses things like personalised care, shared decision making with the patient.
One aspect of this project that I was really excited about as well was testing the integrative software that we utilised for the NHS Health Check for the community organisations. One aspect of this was it was really important for us to capture that data but also make sure that data got sent to their general practice quite quickly and quite efficiently, so things could be actioned if anything kind of cropped up in the health check. The other aspect of this was that the software was designed to be interactive, so the patient could quickly and easily see where they were and what they needed to address in order to reduce their risk.
So I think that having the health checks in the community is a really important health inequalities intervention, because our service users do not attend their GP appointments, their health appointments. This isn't their priority, which is why we now have a healthcare caseload of 100 people who are currently dying with physical health problems because in the past they've never accessed them health appointments. So at the minute what we're doing is we're having them on CGL sites, which is like grab and jab, but we're also taking the service out to some of our harder to reach, not completely hard to reach, harder to reach clients who don't always come in. So we've took it out to hostels, we're taking it out to hubs which are further out in the community, and I think we're getting some of the feedback we've had is people are making changes because they were thought it was going to be a lot worse than it was. So people are now making changes, so thank you.
Wirral Multicultural Organisation has been well established within the community, and we've got a really big centre where people from ethnic minority backgrounds come regularly, either for social events, for cultural events, but also for health events. So they have already been coming here for their blood pressure checks, and then if that was needed, our staff would then support them to go to the GP surgery. So we were really keen to take part in this project, and what people have said to us is that they like coming here for a number of reasons. The time frame is much more geared to their private and personal life. We provide interpretations, we provide some translated materials. If for any reason a health check shows that actually they need a GP appointment, our staff will make that appointment and they will go with the client to provide that language support.
OK， 點解你會嚟呢度做一個健康檢查，唔係去你家庭醫生嗰度咧？
之前都去過嘅，即係有咩問題啊都要去嘅 GP 先啦，係冇？咁依家嘅講嘅 test 覺得自己啊冇乜嘢點嘢，我又咪嚟嗰度檢查下咯，嗰啲 tạm cư sinh乜嘢咁樣咯，係啊，
Okay.
有啲冇了解咁啊嘛，係。
Usually, if it's in a serious illness, and then she will go to see the GP. But because if we just do the health check, it's a quite simple procedures, and then she would like to come here to just do it. Okay, doesn't need any appointment or something. It's easier, and then because with the interpreter here.
Community feels safe in this area. They feel confident. They know us, all the staff around here, so they can talk about their health, especially mental health. And they also say that there's no pressure at all. They can get appointments anytime they want. So we are happy for them to help them with their health condition. Then they are more healthier because their lifestyle is changed. They're more healthy, and then they eat well, they sleep well as well. Because some of the ladies who have difficulty about language barrier, so we have no problem with that. We can help them with translating. We're doing the health check in private rooms, so it's quiet. So one of the staff will be with them, and then we talk about health. So we do weight, we do cholesterol, blood pressure, and then height as well.
So what we found is that these health checks in our place of contribution have removed barriers around travel and cost of travelling and booking, but it's also removed a big barrier around trust and receiving information about people's health in a language and style that people understand and can work with.